the Parkview Health Center Committee to order. Item number 2 is approval of the July 20th, 2023 Parkview Health Center Committee minutes.
I'd like to make a motion.
Second.
With motion and a second, any corrections or comments from anybody? All right, then all those in favor of approving the July 20th, 2023 Parkview Health Center Committee minutes, say aye.
Aye.
All opposed, say nay. Carries. Item 3, public forum. We don't have anybody here. Do we have anybody joining our Zoom?
No.
All right. We'll move right along to item number 4, the financial report.
All right. So I have both July and August in there. I guess more because we didn't have a meeting last month, but I'll just talk about the August one. So as of August, we should be at about 67%. Just going down through the revenues, our Title 19 is running ahead, and that is due to the higher rates that we're getting from Medicaid. So, which is a good thing. And also the next line down, the Wisconsin Health Services, that's our family care, and they actually just went through and raised their rates too. So, 88% there, which is better than we're thinking. And a little farther down, our Title 18 and the Med Advanced Improvement Board running at 20 and 25%. That's just because of the lower census in those areas. We're projecting a little bit higher census for our budget, but we're running lower on those numbers. Farther down, we had our big donation money came in, so that's where that one came in. And that is the amount that was approved for the van. That bumped that up. Where are you on donation? On donation, yep. That's why that's in the 310%. Yeah. The rest are.
Why does it show a deficit amount for donations?
Because if it's a minus, that means we're ahead of what we budgeted.
Okay, I see. Yeah.
And then the other non-operating grant revenues is still higher than what we projected because of the SP money came in a bunch higher than what we were expecting. Everything else is about the same. So total revenue, we're sitting at 64% out of 67, which isn't too bad. Wages, total labor is running in 50.1%, which is pretty good from what we budgeted. So, and we're actually even lower than last year's labor amount. So, travel is still down a bit, but we are having people go to a big conference coming up the first part of October, and it's the leading age one, and we're sending quite a few people to that, so that'll bump that up. The capital you can see in the actual year-to-date column, 240,979. That does now include the dishwasher is in there now.
Unequipped.
And yeah. So the office category is running lower than budget, which is good. Nothing too major on the operating section. Operating is at 48%, still running good. Repairs and maintenance, we're at 67%. Which we did have, quite a few, big projects that, the facilities people have done. With fix the repairs and maintenance category. So, I mean, we're running at 67%, which is right on where we're supposed to be, but a little higher in some areas, like the machine equipment parts. There's quite a few items in there that, were a little bit bigger than what we were expecting. And then equipment repairs also. A couple big items in there.
Boilers come in as expected, or did they come in?
Well. The what? The boilers? Yeah, the boilers, came in as expected. I know they were looking for, a little extra money to finish, replace some cathodes in something, in one of the boilers or something. And that is what came out of the repairs. Not actually equipment itself. Utilities are still running good. Power and lights a little higher than, or the heat, a little bit higher. But that should slowly even out in the next couple of months. And then it'll start going up again, so I think we should be all right there. And then the, contractual services. We're at 57%, so we're running under what we're thinking about there. And our contracted services people, we're at 56%, so we're still looking good there. Had to slowly work up a little bit towards the end, now that the kids are back in school, so. Everything else is relatively the same. In the dark area, the deficit, 7,973,000. If you take out the COVID transfer money, the 8 million, we're actually a little bit positive in there. And then we had actually projected at this point to use about 1.59 million of fund balance, but we're actually a little better than, or better than our projected usage by about 2,300,000.
We be projected to be putting money back in to the
Possibly putting bad money back into the reserve. Well, not using as much as what we planned is. So we plan to use 2,387,000. I mean, if we're still running about the same, we should be pretty close to zero.
Okay, I see. So we'd be on track for it.
We'll
Only 80s, only like 87, roughly 87,000.
Yeah.
Okay.
Yeah.
I got one other question.
Okay.
On the revenues, just looking from the widest perspective here, the revenue total is at 64%, right about where it should be. But we didn't budget for having 97 residents, right?
Right.
We budgeted for having
140 actually, yeah.
So can you walk us through a little bit of how do we achieve close to the same revenue numbers despite budgeting, or despite only getting 60% or so of the way to the budgeted residents?
The biggest part of that is they came through and adjusted a lot of the Medicare rates and then the SP money. So those two things together, and even the family care, bumped their rates up quite a bit. And when I'm talking quite a bit, Medicare went almost up 40%. So that's why we're looking a lot better than what we had budgeted, even with the low consensus.
And then, you said one more question, with the increase in the Medicare rates, how close does that make? Does that make providing care for a resident? I think we've talked at budget time about sort of, well, the more patients or more residents we take, we may not necessarily be fixing the revenue, but if.
Yeah, and now, at this point now, we are actually probably really close to covering our cost of it with the Medicare rates, which is perfect.
On top of that, is that state money that you apply for and all the other elder care houses all apply for the same money throughout the state that are, you apply for it and it comes in, does it come in a large chunk or does it just increase?
It comes in, the SP money is, if that's what we're talking about, it comes in 2 payments. I actually recorded 12 of that each month. And show the other side as a receivable. So it's getting recorded each month in the income statement.
Okay, it was something that was a particular question you had in mind when we started talking about ARPA funds being.
Well, I wasn't sure how it was gonna affect that calculation,
Yeah,
but that's all taken care of, but yeah.
Any other questions about the financial report?
I just have one, I gotta find it. I think it was under tools.
Consumable tools.
Yes, what is it?
So when the facilities needs an extra, some kind of wrench to do a specific project, they do buy like a ratchet or, we had some T-handle, Allen wrenches that we use for the lifts. They had to buy those. And eventually those wear out, but we buy them and put them in their consumable tools because, sooner or later they're gonna wear out.
All right, it's a small.
Yeah.
I gotcha.
All right, thank you so much. We will go to item number 5, the administrator's report.
Okay, census and staffing. All right, so we've got both July and August in here. Census has been pretty consistent at that 96, 97 mark. In August, we had 8 admissions and 10 discharges. 3 admissions or 3 transfers to the hospital and 3 transfers from the hospital. We had 1 that went back to the hospital within their 30 days of admission. We currently have 31 people on our waiting list right now to get into Parkview. And again, these numbers stay pretty consistent month after month. Private pay for August was 21 residents, Medicaid or medical assistance was 64. We have 1 DD resident in-house, so they have a different reimbursement rate. Family care, we have 3 zero insurance, 3 Medicare Advantage and 3 Medicare. That number doesn't match daily center. Total of 95 residents
Oh,
and average yearly census is 96.
well, this is probably the end of the month. Was
Total
95,
number at the end of
and then
August.
actually our average is 96
Okay.
for the month.
With the staff we have right now, what's the most that you think we could hold? Is this what is the most? Could we hit 100? Could we hit 105? What would you say? And I know it's depending on individuals,
Yeah.
what they require, but with the staff that we have right now, what would be your best estimate on that?
This is
Well, 105 is is all the units fully full.
Yeah,
105.
with all the neighborhoods full, we could hold 105. Can we
Okay.
staff 105? No, we
No.
cannot staff 105
And you're talking all neighborhoods,
full,
because we have some that are closed.
No, just the
No.
ones that are
just the
open.
ones that are open.
But
Yeah,
you could not staff you could not take care of 105.
no,
Okay.
not at this moment.
Well, we have five openings in Lake 2. It's a locked unit.
Well, it's
Oh,
not a locked unit,
or-
but there's one pretty disruptive resident over there.
So
What that-
so that unit is down 5, and
Okay.
it's pretty much consistently been down 5.
Mhm. Yeah, one because of staffing and two because there's a pretty disruptive person that is on that wing.
Hmm. And that disrupted person gets to stay there even though they're disruptive.
Well, nobody will take him.
Okay. You wouldn't want to bring more people in there to enjoy the disruption.
Correct.
Okay.
Yeah,
When you say 105 capacity that you can handle, does that mean all the wings of the nursing home are open?
no,
So you have this one shut down, clearly, right?
Three.
So,
How many wings are
Three.
open with that?
Three
wings.
wings are shut, 21 per wing,
If you were
168 total.
168, okay, so it's really. You have 95 total residents and 168 potential total residents, you get staggered.
mhm,
And how many wings are shut down?
3,
Three?
You have 8, so you have 8 wings.
8 wings, yeah, total, yeah.
63 right now are shut down. 63 beds are shut down.
Yeah,
So with that 31 on the waiting list, that would be like a unit and a quarter.
mhm.
How do you make up for that quarter if it's even possible? In other words, you have staffing. But it's an odd number. How do you calculate how many staff you need per person? Are you calculating the staff per room, per resident?
We staff it normally by neighborhood, but also by acuity. So some neighborhoods might have more CNAs because they have more to assist people. Where one neighborhood might not have as many aides because they've got higher functioning residents who maybe only need one person, or some residents are independent.
Regardless, you're short staffed.
Yeah, regardless, we're short staffed.
And not all of the 35 would be like ready to move in tomorrow, right?
The 31 residents on the waiting list, that doesn't mean that all of them are ready to admit. There's some, because we've been contacting them, they go on the waiting list. And as we have long-term beds that are open, we'll contact them, but some people, they're not ready yet, they're still at home, they want to stay there for now. So then we just move on to the next person on our waiting list.
And how long what is the turnover rate on the waiting list?
About, I think it was 8 months,
And I think you mentioned that before.
yeah.
Any other questions about the census?
No. Okay, for staffing then. In August, we had a total of 176 staff members. We hired on 7. Our retention was 93% of staff. We had 9 resignations and 3 terminations. That would include staff that are going back to school, resigning, coming back. We've got 14.5 positions open for RNs and LPNs. That's stayed pretty consistent since March. CNAs is 51.3. Hospitality aides is 9.1, so down 4 positions there. Housekeeping is full, which is great. and food services 2.3 positions. Now, these are full-time equivalent, so a full-time person would be like a 1.0. Does that make sense?
Any
So we-
questions about staffing?
1.0.
Yeah.
So is a retirement or resignation considered
Mhm. Yeah. We had 3 people that completed the CNA training program, so they were promoted to a casual part-time CNA position, so that's good. So that is staffing. Does anybody have any questions on that?
Look at your June, July, and August. It's 6 people that went through training. You had 12 in July and 3 more in August. You know, that's pretty good.
Mhm.
Picking up.
Yes,
But
yes. So a lot of them are high schoolers, some are college kids, so they're not working, some are even they're not working full shifts. Some people are coming in, they'll work little 4-hour increments, but all of them are aware of the commitment to work a particular amount of hours after going through that class, so and some of them have already completed those hours, just working through the whole summer. So every little bit helps. So, and again, for staffing, we do have that sitting out with international manpower for international workers too. So waiting on that. I think we put our application in with her. I think it was the end of April, so it's a 6-month, or I think it's an 8-month process before we hear anything back on that. So waiting on that to come through too. So we also have this isn't on the docket, but we've got a RFP, a request for proposal that's out there right now on Demand Star to look for basically a strategic plan for Parkview, looking at the closed neighborhoods that we have and seeing what the opportunities are within Winnebago County. If it would behoove us to change over some of those beds into like some sort of assisted living for maybe staff, low-income housing for employees. If it might be beneficial to look at some of those rooms for high-functioning disabled adults. So kind of looking at the various options, and so they would do a market research. They would talk to you all as well too, as far as your opinion, and as far as like the county board, where would you want to go? But they'll really look at the market and future of Winnebago County and the surrounding state and national trends to see what is the need going to be. So we can, I mean, I know we're projecting to do well, but you know, it's just adding to that financial stability of moving down the road for future.
How long has that RFP been out? Have you had any response to the bids yet at all for that?
So it just went out last Friday. And there are 3, and I reached out to a 4th company for requesting them to put in a bid.
Okay.
So I know 2 for certain will be putting bids in.
This is not a sale of the entire property or anything having to do with
Absolutely
that.
not. No, it's
Okay.
nothing like that. No.
You're too profitable, considering what your overall objective is in housing the elderly and the disabled and whatever.
Right.
You don't need to make a profit, yet you do make a profit. And I don't see where that talk comes from, but it's out there.
It's out there.
It just seems that that's something you kind of have to turn on. Even when you put an RFP out there, don't So let them put a for sale sign, would drive up into the parking lot.
No, that's not one of the, no, that's not one of the stipulations, in that RFP. It's, what do we do? Do we stay at skilled nursing and totally? Do we, you know, and what other options do we look at? And how is that gonna fit for us financially? And can we staff whatever it is that the market is suggesting we do? So just kind of, you know, looking at our options and just, we wanna just make sure that we're going to be financially sound.
And part of it is, you know, making sure that there's gonna be a need for 168 beds. That's the bigger concern is with all the other nursing homes in the area. Is there gonna be a need for us to have 168 beds? If it's only 140, well, then we got 20 more beds that we can do something else with.
Have the nursing homes in the area been adding or expanding space? So you're kind of well poised to absorb any additional increase if you have, 168 total units, maybe 95 of them occupied. So, if the demand is generated, you're well poised to accept that. I mean, it will be some difficulty in terms of when you decide to open the wing, you have 35 waiting lists. So how much would the waiting list have to get to before you consider, you can't, just because of the staffing issue, you'd want to, but.
Yeah, if we had the staff.
But is there a break even point for opening the new wing or not?
Well, I think the money generated by the people coming in would pay for the staff.
Would cover it.
Mhm.
So,
And then you have to be careful too, and you're more of an expert on this than I am, of what change you make to those wings, that it doesn't affect anything else that comes in for Parkview. Does the state look at that? How would the state look at that? If you said, well, we're gonna do a wing for assisted living, or we're gonna do a wing for staff that we can get some CNAs internationally, how does that affect
Your overall,
Parkview as an overall nursing home with benefits that come our way?
your overall predictivity has to be predictable.
Yeah, I mean, we would have to put a plan in with the state and they'd have
that's what
to
I
approve
thought.
it, and you'd have to have an architect involved, because when you're changing what the utilization is for the building, it's no longer the plan that the state approved.
Right.
So therefore, they would want us to put up a firewall for basement to roof if you're no longer utilizing that as a skilled nursing center. But then if you change it to, say, assisted living, they have their own set of regulations, so making sure that you have to apply for that licensure, and then making sure that you are up to snuff with those regulations with a separate entrance and all of those things. I mean, the room size and the size of the hallways, like none of that is a concern, because ours are nice and wide and we're not an older building. So those are things that we don't have to worry about. I think the firewall would kind of be my biggest thing, and making sure that we have the staff, and that's a whole separate avenue as far as training, and the training that goes into an assisted living, because there the resident assistants can pass medications. It's not the nurse, so they have to be trained on that, and the nurse has to give that delegation to them and have that trust that they can pass medications responsibly.
We have an assisted living facility in the county already, right? Do we not?
We have the crisis center, which is, it's licensed as a community-based residential
Correct, so you're,
facility,
how
yes,
many units in there?
16.
Beds.
Is that
So-
run by EHS?
It is, yeah.
Was
'cause
that,
it's
was
the-
that built after this? I'm assuming it was built after this, so there was a need there that was fulfilled by building a new building, maybe some of the. Arduous reasons you're talking about here is why they decided to build new, because. It's easier to construct a new building probably than to refit an old one.
So their stipulation with the the CBRF there is, they're a crisis center, so when you walk into one of those rooms, it's, you know, no toilet seats, it's more conducive to somebody who may try to hurt
I
themselves.
see, okay, so that's not really traditional assisted living.
Correct.
So do you think there'd be a need for assisted living units out in the market that would justify converting space here to that?
That's why we've got that RFP out there, yeah. Cause I'm not, you know, I'm not that expert in that,
Right. Okay, well.
yes,
all right.
so.
Have you talked to Dr. Tobin with regard to assisted living?
No,
And,
He's generally said that there's a shortage of assisted living space.
now,
I know when we acquired the two buildings for this county recently, he indicated that there was a shortage of units out there in the county, and that, you know, there would be demand to convert, for example, Harrison Street back to CVRF because there's enough demand out there, and therefore that, you know, why we should acquire it. One of the reasons for why we should acquire it was that we couldn't find existing space out there that we could transfer to out of that facility. Or need, but, well,
that would be, I don't think you're in that RFP, see what Bill Tobin would have to say with regard to assisted living.
sure.
And would keep it in a family and,
Yeah.
you know,
Mhm. Any there's questions, otherwise I'll go to, incentive usage quick. So as far as incentive usage, it's been pretty consistent, I mean, it varies month to month. But I'll say now, because we've been doing this for a year, the numbers from last year's payroll this time to this year's payroll is pretty consistent. There's only a variant of 24 hours, which is increased this year, so, which is 3 shifts. So it's pretty consistent as far as incentive usage from this time last year.
About the incentive usage.
are they giving you any trouble through the payroll department as far as lining up and making sure that all of the numbers are coming out when they go to pay payroll? And like, we got a new person up there, and we got Joan up there, and has been up there for some time.
We usually have all of that pretty much set in the system before it goes down to them. We can go through it ourselves, make sure that it's correct before we send it down to them.
Good.
Any other questions? All right, thank you very much for the administrator's report. I'd asked that item 8 be put on the agenda, a discussion of the proposed budget. It was on our September agenda. I think we all had enough of what happened of the changes to the budget process on Tuesday. So we don't have anything to discuss. I don't know, is there anything else you'd like to say about that?
I can say that there wasn't any budget add-on requests from Parkview this year, so it's a pretty standard, straightforward budget from Parkview this year with no added requests. So I was told that the numbers were finalized today, and so books are going out to print, so they should be to you before I believe the deadline for everybody to receive their books was the 16th of October. But sounds like that would be coming to you sooner than that. And I guess there's gonna be an electronic version that will be available within the next couple of weeks. But
How about the whole budget book?
an electronic version in the next couple of weeks, but the actual book sounds like it will be ready before the printed book will be ready before the 16th, it sounds like.
So you don't have anything that you need a resolution for at budget time? No, that's all right.
No,
Think it over.
no, I mean, we've pretty much,
So a lot of the things that came up, we have been able to take care of
mhm,
with what we've had.
Dishwasher and hot water heaters.
Yeah.
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 And did you order the van?
Yes,
we did.
it is ordered. They are in the process of doing the modifications right now, so.
Oh,
And Mr. Vinyl is gonna do the van wrap on it.
okay.
So we'll have a QR code on the back that will go directly to the county's application so they can apply for jobs.
Got room to store it alongside the old one?
Yeah, we'll be working on trying to get rid of our red smaller van, the 12 passenger one. We're looking at putting that.
Were
out
you
for
able
service.
just to go out and buy it?
Mhm,
All right.
mhm,
Okay,
2023.
yep,
When I asked that, what year was it?
just for you.
Brand spanking new, I think 7 miles.
I think you get more with brand new than you do used.
Mhm.
Yeah,
Sometimes.
less headache and a little bit of warranty.
Yeah.
Okay,
So do you want me to, I can put this on the agenda for next month? Since the budget will be out and then we can discuss Parkview individually at that time?
Yeah.
Okay,
And I know this is not, this is not anything under your control, but I'll just say as the chair of the committee, this does not bring trust or transparency for my support for this budget. I disagree with the assessment that this place isn't for sale. I think the rumors are out there for a reason. The lack of transparency from the administration feeds into this. And as far as the contacts that I've got the last couple of days, they've very much been oriented towards this place is for sale. So if that is not true, that is going to be on the administration to put that information out there, because I don't consider myself in the know, in the loop, or a defender of what's going on anymore because of the process that the executive has put out. Right? Don't mean that to be directed towards you all at all. I understand the position that he's putting you in, but it's just a sad state of affairs that this committee, other committees aren't trusted partners in this process.
all set.
Are there other suggested topics for next time besides a budget review? Okay. Our next meeting is October 19th at 3:30. Is that good for everybody? Yep. Right. All right, then we're all set for adjournment.
I'll move to adjourn.
Second, all in favor?
Aye.
We are adjourned. Thank you all.